The important role of genetic screening. All expectant parents want what's best for their babies. As you prepare to grow your family, it's important to know that there are screening tests available that can help you understand the potential for any issues so that you can make the best decisions for you and your baby. Screening tests are done at different points during pregnancy and for different purposes, but each is performed with the goal of assessing possible complications. It's important to understand the difference between screening tests and diagnostic tests. Screening tests do not give definitive answers, but diagnostic tests such as chorionic villus sampling and amniocentesis can provide definitive information about a potential problem. That's why diagnostic tests are often done after a screening test has identified an increased chance of an issue in a pregnancy. Carrier screening and non-invasive prenatal screening are genetic screening tests that are done early on to inform the care of your pregnancy and baby. Genetic screening has been made possible by advances in technology, but they are a lot like the screens pregnant women have been having for decades. You can think of genetic screens like ultrasounds for DNA. We can get a better understanding of genetic screens by going over some of the basics of genetics. Inside every person, there are trillions of cells. Cells in different parts of the body have different functions, but almost all of them contain the same genetic information. And most of that information, it's stored in compact chunks called chromosomes. Chromosomes are composed of tightly packed DNA. DNA is like the blueprint for a person. Small segments of DNA act as the recipes for individual proteins. Those segments are called genes. Genes pass along family characteristics like hair and eye color. They can also pass on genetic diseases, even if the parents don't have any symptoms. Non-invasive prenatal screening can help determine if a pregnancy is at heightened risk for a common chromosome condition. Carrier screening is performed at the gene level and determines the baby's risk of having a condition passed down from the mother and father. For more information, speak with your provider